An emergency approval now would change the way in which folks view trials, mentioned Dr. Mila B. Ortigoza, an infectious illness specialist at N.Y.U. Langone Well, who began a trial with colleagues at Montefiore Medical Heart. "We wish to be sure that once we say it really works, we're assured, with indeniable proof," she mentioned. "We're coping with sufferers' lives right here." In contrast to the malaria medication, plasma, which has been used for the reason that 90s to deal with infectious illnesses, has earned the eye of an extremely credentialed neighborhood of microbiologists and immunologists desperate to show its usefulness. The Mayo Clinic has already printed evaluation on tens of hundreds of sufferers in its expanded entry program displaying that plasma is protected. The newest batch of knowledge from this system included greater than 35,000 COVID-19 sufferers, lots of them in intensive care and on ventilators, and prompt that plasma administered inside 3 days of a prognosis lowered mortality charges. When calculated a month after the infusions, the loss of life charge of sufferers who acquired plasma inside 3 days of prognosis was decreased 21.6 p.c. than it was for many who acquired plasma later 26.7 p.c. However, the research didn't have a management group of sufferers given a placebo to check with these given plasma, making it tough for scientists to evaluate whether or not the remedy actually labored. And given the restricted provide of plasma, it isn't clear how lifelike treating sufferers inside 3 days of prognosis can be. This system's enrollment has surged to greater than 30 instances, as excessive as initially anticipated, complicating the flexibility of scientists to recruit sick sufferers to randomized trials. "It ballooned to a level that, you already know, is turning into unmanageable," Dr. Lane mentioned. Statisticians on the F.D.A. are actually analyzing the Mayo knowledge to perceive what elements apart from the remedy may need influenced affected person responses, reminiscent of higher quality care within the hospital, Dr. Lane mentioned.